Recognize risk factors. Individuals of any age can develop septic arthritis. However, some people may be more susceptible to this condition. Children, older adults, and illegal drug users are more likely to have septic arthritis. Other risk factors include having existing joint problems such as gout or lupus, taking medication for rheumatoid arthritis, having fragile skin that breaks easily, having a weakened immune system. Watch for swelling. Septic arthritis generally comes on quickly. Symptoms are usually in one joint, though in rare cases may affect two or more areas. One of the most common symptoms of septic arthritis is swelling around the affected joint. This is caused by a buildup of infected fluid around your joint. Watching for swelling in one joint can help you diagnose septic arthritis. Pay attention to any warmth and redness that accompanies the swelling. This can also indicate septic arthritis. Notice pain and immobility in the joint. The swelling caused by septic arthritis infection can also bring on mild to severe pain. It can also lead to an inability to fully move your joint. Watching for any pain and immobility in the joint can help you diagnose septic arthritis and seek prompt treatment. Recognize that your pain may get worse when you move the affected joint. Check for a fever. Infections, including septic arthritis, are often accompanied by a fever. This is a sign that something out of the ordinary is happening in the body. Taking the temperature can indicate a fever, which may be the result of septic arthritis. Recognize that chills, muscle aches, sweating, and headache are common symptoms of a fever. These may also accompany a fever with septic arthritis. Observe fatigue and weakness. Two symptoms that are common with a fever are fatigue and weakness. These can also accompany septic arthritis. If you experience fatigue and weakness along with other symptoms of septic arthritis, you may have the condition. Recognize typical symptoms of weakness and fatigue, which include delayed or slow movement, muscle cramps, muscle twitching, and uncontrollable shaking. Feeling run down is the most common symptom of fatigue. Detect irritability. Most symptoms of septic arthritis are physical. However, some may be emotional or behavioral, especially in infants and small children. Noticing if you or another person are irritable can indicate septic arthritis, especially when in conjunction with other symptoms. Look for fussiness in children and infants. This can accompany any irritability they have. Schedule an appointment with your doctor. Only your doctor can definitively diagnose septic arthritis. If you have sudden onset of severe pain in a joint or any other symptoms of septic arthritis, contact your doctor as soon as possible. Prompt diagnosis of septic arthritis can minimize potential joint damage, including degeneration. Schedule the first available appointment by letting the doctor's staff know that you have the symptoms of septic arthritis. Undergo an examination. During your appointment or exam, explain to the doctor that you suspect you may have septic arthritis. Discuss any symptoms you are experiencing as well as other relevant information, such as if you recently had surgery or a puncture wound. Your doctor will consider this information while examining your joint for signs of septic arthritis. Answer any questions the doctor may have honestly. Remember, the doctor is trying to make a proper diagnosis and formulate the best treatment plan to minimize the risk of more serious conditions. Get your blood and joint fluid tested. Depending on the examination, your doctor may order additional tests. These can give a more definitive diagnosis of septic arthritis. Have imaging tests. In addition to joint fluid and blood tests, your doctor may also call for imaging tests. These can confirm the presence of infection as well as if your joint is damaged. Imaging tests often used for diagnosing septic arthritis include X-rays, MRI scans, CT scans, bone scans, Ultrasound. Receive a diagnosis. Based on the outcome of an examination and any testing, your doctor may diagnose you with septic arthritis. Your doctor will talk to you about the results of your testing, including any damage in your joint. Your doctor will also discuss your treatment options. Ask your doctor any questions you may have about the diagnosis or treatment. If you have a MRSA infection, you will need to treat it with 4 antibiotics such as vancomycin. This is the safest option for treatment given the prevalence of MRSA in hospitals and the community.